Okay, hi guys, welcome back to another video. So it's been constantly diabetic videos, and today is another diabetic video, as the title mentioned, because a lot of patients ask me, and I also ask myself, is diabetes permanent? A very fair question, because back in the old days it is a disease whereby it is a progressive disease and kind of there isn't a reversal, but newer science do say that it is in a way a reversible metabolic state, but it's not as easy as it sounds, and it comes with a lot of caveats. So let's get into the definition of what is diabetic remission. Now, diabetic remission, you have to ensure that the HbA1c or the average reading of your blood sugar levels are less than 6.5%. If you don't know what HbA1c is, watch another video previously. But the important caveats are, it has to be at least for 3 months less than 6.5% without medications. So if you're on medications and your HbA1c is good, it's great, but that does not count as remission. Now, we use the term remission because cure would mean that it's cured, it would not come back, but there are multiple risk factors for diabetes that predisposes someone to get the disease. So we can't say cure fundamentally. Now, what is the important mechanism that can push someone into remission? So we have liver fat, we have pancreatic fat, and both of these would induce insulin resistance as well as make the cells in the pancreas, the beta cells, to shut down. So the American Diabetic Association do reckons that a weight loss of more than 15 kilogram removes this visceral fat or fat around the organ and improves the function or reduces the resistance, and hence someone may go into remission. Now, if we look at a recent trial, which is the direct trial, 86% of remission rate in participants who had more than 15% weight loss. It's not just about the loss, it's also about maintaining it. Now, let's look at the hierarchy of the intervention. So level 1 will be intensive lifestyle, which is mainly diet. Our target here is 10 to 15% of the body weight loss, whereby not the easiest, but the most sustainable and sort of the most effective would be calorie deficit. In a day, based on your height, weight, if you require this amount of calorie, you need to consume lesser than what you should. That's calorie deficit. So based on the ADA, right, if you want to have a general improvement in the diabetic disease, then you just go for a 5 to 7% of weight loss. But if you want to achieve remission, then you need more than 10 to 15% of weight loss. And now let's go to level 2, whereby we introduce physical activity. Now this will support maintenance and also ease the insulin sensitivity, ease the insulin resistance, and promote sensitivity. And level 3 is metabolic surgery. Now, we won't go too much in detail about this, but these are indicated for people with morbid obesity, and we require rapid structural change. And with such surgery, of course, they may achieve up to 80% initial remission. Okay, so now let's address some important questions like, hey, my HbA1c is 6.3, so am I in remission? Now, first I gotta know, are you on medications? Because if you're on medications, all these medications act in their needed pathways to improve your metabolic diabetic control. So if you're on HbA1c 6.3 and you're on medication, then the answer is that your diabetes is controlled. It's not in remission. So please do not stop your medications abruptly. Remission would mean you have no medications and your HbA1c is well controlled, less than 6.5, which means your body is regulating this glucose. So the strategy here is to de-intensify slowly with the guidance of your physician. So the golden window for intervention, as I've also mentioned in my pre-diabetes video, is that you are not on medication yet, your system is not dependent, you need an aggressive lifestyle change. We need an aggressive lifestyle change, and this can definitely improve your resistance and prevent permanent damage. So this number is based on the American Diabetic Association, but if you're from the region I'm from, then HbA1c of 5.8 to 6.2 would be pre-diabetic, and anything more than 6.3 and anything more than 6.5 as per the American Association is considered diagnostic diabetes, where all of the vascular damage starts to begin. So once someone is diagnosed with diabetes, and the body will start to slowly have vascular changes, because the vessel wall will start to undergo a lot of changes, which is interesting. Perhaps I should make another video on this. And in this stage, reversing trajectory is harder, but nothing is impossible. Now the relapse. Okay, so let's say you are having HbA1c of less than 6.5. It's now about a year, and then you begin to gain your weight, and which means there are more fats sitting around these important organs, which means increasing insulin resistance and reducing your function of your pancreas. Highly likely one is going to have a relapse. So remission is conditional on maintaining the weight loss. And another point to remember is, of course, our organs are going to deteriorate with wear and tear, with age. And remission is never a finish line, but instead it is a maintenance protocol, which, frankly speaking, as we age, it is not so feasible to, go and do a zone 2 workout, right? So that's going to be a bit challenging. So it comes down to a lot more of diet. I guess, like they all say, it all begins in the kitchen. Okay, so now let's look at the system maintenance code, where we need to build muscle mass. How do we do this? And this is something that all of us are advocating for, and even people in my age are going all out on strength training, because there are lots of benefits. And resistance training maintains glucose disposal, which means insulin sensitivity. Your cells are still sensitive to insulin, where glucose can be pushed in for it to be utilized. And in a way, it's not so dependent on the diet. Of course, you don't overdo the diet, but yes, so resistance training is crucial, building muscle mass. And in fact, if you're in the older age group, you do need good muscle mass, as your bones will decline with age. Annual monitoring, check HbA1c at least once a year, because to diagnose diabetes, most of the time it is silent, and relapse is also most of the time silent. And complication screening. So yes, for people who are diabetic, they need an annual screening, as I did mention about the vascular changes, where the vessels are going to harden, break down. So you need to take a picture of your retina, check your nerves at least once a year. But if someone has achieved remission, then according to the ADA guidelines, you just need to screen once in 5 years. So, can everyone experience this remission? Now, the simple criteria, or the better candidates who would undergo remission and maybe stay longer, would be someone who has a diabetic diagnosis of less than 6 years, as it's still a shorter duration, so maybe the irreversible damage isn't far too long. And someone who's not on insulin, very crucial, because if someone is already on insulin, means you have quite a great amount of insulin resistance, right? And a younger age demographic, because a lot of this comes from a physical component, and you have to be strong at that. So the groups that to be cautioned with, or do not abruptly do anything, is like never stop insulin without supervision. And you may experience a scenario where we call diabetic ketoacidosis. If you are a type 1 diabetic, or even type 2, with abruptly stopping your medications. And this also may not be so ideal for pregnancy, extremely low BMI already, you can't lose more weight, or type 1 diabetes, as they are a totally different mechanism of why someone is experiencing high sugar levels. So what is the action plan then? The action plan is know what is the definition, what is your goal, what is your target, then we need to achieve it. I say we because it's the patient and the healthcare provider come up with a very personal care of diet and physical activities to achieve this 10 to 15% weight loss via calorie deficit. And then the most difficult part is to maintain the weight, monitor your glycemic index annually, prioritize muscle mass, and of course we all want to avoid the relapse trap. And these are my references should you want to read up more. But of course, if you are a patient who is not from a healthcare background, please consult with your physician before taking on any advice and implementing it onto your own self. This is for public education and my education. So I'd like to say a big thank you to everyone who's been watching the videos. I truly appreciate your support. It makes me understand better and helps me to educate the public better. And till then, I will catch you in another diabetic or maybe non-diabetic video. Please let me know what questions you want to be answered, and I will try to look up some sources to share with you.